hard to make sure that people who feel concerned about security individually, but more importantly perhaps for our sites, continues to be reviewed and strengthened, and to make sure that we have put in place all of the appropriate mechanisms to keep our organization and our people safe.
Yeah, I mean, unless you're a client of theirs. The first video that I ever did where I actually did any type of investigative journalism undercover or on location was a video on the Canadian healthcare system. Because back in 2009, Michael Moore and all these other liberals were saying that's how we needed to reformat our system to mimic that.
Yeah, you first, Michael.
Yeah. And well, he also said that Cuba was better than the United States for healthcare. So I disagree with that. But I want to be really clear. I also understand why people believe that our system is broken here in the United States. It absolutely is. My question to you, before I move on and get through some of these historical facts here, and some numbers that may surprise you, is why do you think that this system is broken? And how do you think it needs to be fixed? Do you think it's because it's capitalism run amok? Or do you think it's the most heavily regulated industry in the United States and largely subsidized? So I get it. When people talk about, a lot of people have been happy, unfortunately, over the murder of the UnitedHealthcare CEO. The search is continuing for this murderer, although we did just get a hint with, we found out who was in charge of his security.
That checks out.
Jeez. But we also have more to report on this. We actually have an exclusive here because you have sent us your tips. We actually have an insider right now at UnitedHealthcare, which brings us to Mug Club Undercover. So just to set this up, a source inside UnitedHealthcare sent us this all hands on deck call discussing the CEO Brian Thompson shooting. This comes from an insider there, and we do ask before I show this to you, again, if you see something or if you have any information that could be helpful, send it to lwctips@protonmail.com. That's lwctips@protonmail.com. We are always busy chasing down leads, and this is just the tip of the iceberg. Here they are at UnitedHealthcare. something, all is well.
I just want to take a moment to pay tribute to Brian. We've lost a friend, a colleague, a boss, a mentor, a great family man, a dad, somebody who has been incredibly important to many, many people across our organization, and somebody who was pivotal in the development of United Health Group, and always somebody who could bring a smile to a room. We've also been working hard to make sure that people who feel concerned about security individually, but more importantly perhaps for our sites, continues to be reviewed and strengthened, and to make sure that we have put in place all of the appropriate mechanisms to keep our organization and our people safe.
Yeah, I mean, unless you're a client of theirs. And yeah, this is a problem with a lot of health insurance companies. So a lot of people were happy about this murder. I am not amongst them. Taylor Lorenz, I guess this person's Substack said, why we want insurance executives dead. Reddit actually had to delete threads because they were filled with doctors torching the United CEO, and largely the feedback was praising of the murderer in this case. Yeah. The hotel or the hostel, I guess, where the assassin stayed was actually review bombed for cooperating.
Hold on, hostels have reviews?
Yeah, I know. It's like,
I thought it was just like, pay $5 and hope not to die.
I didn't get raped, so it was pretty good.
That's pretty nice. Pretty nice.
So these are some of the reviews. They're mad that people are cooperating with the authorities at all, saying, terrible, staffs are narcs, no solidarity with their fellow humans struggling to free themselves from an oppressive yoke.
Oh, good Lord.
Let me explain something to you. When you look at the fact that about 15% of all claims are denied by insurance companies, and that pisses people off, and then you understand that UnitedHealthcare actually denies on average 32%, right? Significantly more.
That's a lot.
And in some case, necessary medicine. I get it. I get why people are upset, and I get why people recognize that the system is broken. But this is terrorism, to be clear. Do we want a world where we just go out and we execute every CEO? And how do you determine which CEOs deserve to be executed? Look, I also think that the anger, the vitriol is aimed partially at the wrong people. These health insurance CEOs, they're taking advantage of a system that has been set up and subsidized by government. Not only, I shouldn't say set up and subsidized, demanded by government. If someone was looking for some type of a culprit here, they would look to the people who voted for the Affordable Care Act. And I know they won't because they hear the name and they think it sounds nice. But do you guys understand why health insurance companies in this country have the amount of power that they do? The Affordable Care Act was the biggest kickback that has ever taken place, likely in American history, for health insurance companies. How has it gotten this expensive? Let's go through a few key facts here. And you can chime in whenever you want, Joe, because I know this is something that you've had to deal with too. So key fact number one. Just going through the Affordable Care Act. The ACA forced everyone to buy insurance. So right away, imagine if you are a business. Anyone out there, a business owner, small business owner? Let's say you own a diner. Imagine if the government said, everyone has to get lunch at your diner. Would you consider that a boon for your business? Probably.
You love it.
Probably. So that's what happened. A lot of people, because it started with the single payer option, thought, oh, this is going to be socialized healthcare. Ultimately, it ended up being a giant greasing of the palms of the insurance company. So anyone who was not insured had to get insurance or pay a tax. Now, Donald Trump eliminated the mandate on a federal level, but a lot of states, they still have penalties for noncompliance, like New Jersey, California, Rhode Island, Massachusetts, D.C. And by the way, the damage was already done at that point. So you had to pay an exorbitant tax or you were forced to get insurance. Because a lot of people were not getting insurance before that. A lot of people were young people who opted to not pay for insurance because they assessed the risk.
Right.
Now,
pay cash.
Everyone has to get insurance. So you're talking about a record number of people who have to purchase insurance. Okay. Now, that may not necessarily be bad. Because you say, okay, well, there are more people, so it's a bigger pool, so that should reduce the costs. Well, here's the thing, key fact number two. The ACA forced insurance to cover everyone with pre-existing conditions.
Bingo.
Which is so now everyone has to buy insurance. And insurance has to accept everyone, including those who may have self-induced diabetes because they've lived on a diet of Funyuns and Code Red. And this is so
tasty.
So you don't have just a bunch of new, young, healthy people joining in, lowering the overall risk pool. You have a guarantee that these people joining now will increase the cost.
That's right. Where have I heard something like this before? Everybody should own a home and you can't turn anybody down for a home loan. How did that work out?
Exactly.
That seems like the same playbook that everybody should be able to do this. We already had, by the way, most people don't know this. You already had pre-existing condition pools. If you had a pre-existing condition, that's more expensive, right? You had to go into what they call the risk pool in your state, which is more expensive because it's filled with people that have higher risk. You try to mitigate it to some degree by putting healthier people in there, but you don't screw the healthier people to take care of the people with pre-existing conditions. And people are like, oh my gosh, you have to have some kind of health care. Emergency rooms. That's a really bad thing to use, but it was the ultimate fallback. They can't turn you down.
Right.
If you have to go in for something, you can go to an emergency room. That's what we've talked about with illegals. They use that kind of as health care and it's way too expensive. They don't need to do that. People thought that this was an easy solution. The general public, like, this is a great idea. It's a terrible idea.
Yeah.
It's like having no fire insurance for your house.
It's like forcing every single driving insurance, car insurance, to cover people who have suspended licenses.
Yeah, I'll just wait to get insurance until after the accident or after my home.
And that's what a lot of people did.
Stupid.
Exactly. So what you saw with this, again, everyone has to buy insurance, and insurance you have to accept everyone with every condition, no matter what, no matter how much it offsets the cost. What happened is they decided to offset the cost by obviously increasing premiums and deductibles.
Yes.
But also by denying far more claims, right? Yeah. You actually saw 3 and 4 providers were actually surveyed, said that denials have gone up dramatically. They've even created denial algorithms. In other words, they're going to cut costs somewhere. And then we also see, fast fact here, key fact number 3. When you marry, everyone has to buy insurance. You have to cover every single person. They go, oh my gosh, that's going to be crazy. Is there any limit to how much we can raise expenses?
No.
Absolutely not. Charge whatever you want.
Woohoo.
Good to me. So what did we see? Under Obamacare, premiums went up by 80%. Deductibles went up by over 50%. And I believe this is really only the first couple of years.
I was about to say, I can give you my example in a second.
Yeah, they've gone up hundreds of percentages since then.
In the course of a year, I think I went from paying $90 to about $400 for a health savings account plan that had a $3,000 deductible that then went to a $6,000 deductible. Nothing about me changed.
Yes. Well, you know what else happened too is 70% of counties in the United States basically were left with no more than 2 insurers, meaning 1 or 2 insurers. No competition. A big reason for this is mergers and buying and acquiring. And so there's significantly less competition than there used to be, and costs are higher. And here is another one. None of this happens, by the way, None of this, the same thing when you're looking at the housing market, the same thing when you're looking at airlines and CEO pay, the same thing when you're looking at American auto manufacturers. If you look at a business and you go, hold on a second, their business really sucks. Customer satisfaction is an all-time low, and their CEOs are getting hundreds of millions or tens of millions of dollars, especially if you're looking at an industry that's struggling to be profitable. If you see that, guaranteed government subsidies, guaranteed bailouts, because it occurs nowhere in nature. See, I get it. So the key fact here is unlimited government bailouts. We'll go through that, but let me explain to you. This is a problem with the current capitalist system, and I'm a free enterpriser through and through. But, for example, if you look at UnitedHealthcare, okay, they have all this red tape and all these government policies they have to navigate, and they ultimately are looking for either government money or to squeeze out more profit for their shareholders. There's a big difference between healthcare that we used to have, where the actual healthcare providers, doctors, nurses, practitioners, were largely in charge of determining the care, versus today it's administrators and it's red tape. And these people, when your company that provides goods or services is not beholden to the satisfaction of those receiving the goods or services, the consumer, but really, this person providing goods and services has a fiduciary duty exclusively to shareholders to squeeze out as much profit as possible. That is now a warping of the free enterprise system. And I get it. Nothing has created more wealth in history than equities. But we do have a problem, and it gets really, really bad once you involve government intervention.
I think that's
once you create too big to fail.
Yeah, I really do think that is the key to the health. I agree with you. Like, these companies, like, we have to have for-profit medicine to some degree, right? They have to be able to make a profit. I get it. It puts people in a precarious position, but doctors and nurses typically do a great job of balancing that, as long as the corporate people aren't pushing too hard. I get it. It's gone to administrators too much. But the government going into this industry has caused the vast majority of the problems that we're facing right now.
Right.
We know that just by paying cash versus not paying cash. The cost goes dramatically down. Do you understand how many people we could cut out of this industry if we didn't have to have people specializing in coding stuff properly to get paid by Medicare or Medicaid or any health insurance company? Like, you just go back to a cash system and people taking care of themselves and having catastrophic insurance just to make sure you don't go bankrupt if something bad happens. What a better system that would be. But no, we have to have government involvement, and we have to have people pushing for even more government involvement.
Let's look at the government bailouts and the subsidies. So just for example, in 2020, the CARES Act, right? That was $2 trillion. Now, it didn't go directly to health insurance companies, but it did benefit them by, for example, allowing them to just postpone expensive medical procedures indefinitely, right?
Because of COVID,
Thanks, COVID. Of course, there was taxpayer-funded COVID tests, vaccines, and of course, you have
those tests
unholy alliances between insurance companies and pharmaceutical companies, right? They're not looking out for your best interests. It's just too much money on the table, especially when there are trillions of dollars in government funding out there. Sorry, your tax dollars, while you were forced to lock down and lose your business. 2016, right? Obamacare, there's $170 billion in bailouts to insurance companies, right, to keep them on the exchanges. So we had bailouts on top of waste. I don't know if you remember this, but Barack Obama spent over $2 billion on the healthcare exchange website that didn't even work.
Well, that sucks. Yeah.
We go back to 1995. You had a $364 million bailout of the Los Angeles County healthcare system by Bill Clinton, right? And this is part of it was basically to prevent firing of union workers or rendering it non-profitable.
They're the best among us, Stephen. They would go to their work no matter what.
Right. So you have all of these bailouts. You have bailout, and this is a great, especially during COVID, right? It's the greatest wealth transfer that has occurred in modern American history. It occurred because of the government. It occurred because of mandates. Your tax dollars, $2 trillion, while your business was shut down. Or while maybe at the same time, you had to pay your mortgage while someone else was granted rent forgiveness. And so you lost your property. You were paying and funding for insurance companies to get kickbacks, for pharmaceutical companies to get kickbacks. When your store was closed down, your tax dollars ensured that those who could lobby to make sure Walmart and Costco could stay open, their business was safe. Where Amazon saw increases in revenue, depending if you use the annual number, the total number, hundreds of billions of dollars annually, while you lost yours. Your money, if you were worried about, you're doing it for the greater good. Hey, we're a nation who takes care of someone when they're down. Well, I hope you find solace in the fact that during COVID, when you were shut down and your savings account was irreparably damaged, you were paying for very wealthy billionaires across this country and their lobbyists, which brings us to key fact number 5, the lobbying that you see.
Yeah.
The lobbying that you see from health insurance companies. Again, these are not doctors. Very different. These are people who have companies and are looking to squeeze out a profit. And by the way, the biggest tenet of their business model is making sure that they are on the right side of government, because when those bailout dollars start flowing, they're first in line. Health industry as a whole, their lobbying is up 70% since the year 2000.
Dang.
70%.
Jeez.
Insane.
7 of the top 10 lobbyists on the Inflation Reduction Act were pharmaceutical or health insurance companies. Think about that. 7 of the top 10 lobbyists in the Inflation Reduction Act were pharmaceutical or health insurance companies. Hey, what do you need to keep lobbying for? At what point is hundreds of billions over time not enough? This is when people no longer have faith in their system. And I'm not a Bernie bro, not a socialist, but you want to know how you end up with some kind of a guillotine situation, is when people who are suffering, who are getting their claims denied, who are seeing their premiums go up, who are seeing their deductibles go up, they're seeing the worst service they've ever seen in their life, and a company that is more profitable than ever. How does that happen? Nowhere else. You go, this restaurant, if it sucks and I hate it, I don't go back. They lose money. The coffee shop, they started serving crappy. I don't go there. For some reason, they're more profitable than ever. That's when people feel like they're completely powerless, and you end up with terrorism in the streets. And so it's not lost on me, but we need to be really clear about where the problem stems here in the United States. And you cannot have this awful, this giant, this leviathan, this hungry beast that is the health insurance industry without constant, never-ending supplies of federal dollars, some taxpayer dollars. This goes to a key fact here, number 6, the administrative costs that are just growing out of control, right? This is something that we are seeing in the healthcare industry. Just since the 1970s, the administration costs have gone up 1,115%.
Jeez. Must be helping.
No, this is the number.
Oh, sorry, the number of administrators. This is not the increase in costs. Yeah, the number of administrators has gone up. Sorry, I'm sorry. I misremembered. From the 1970s, I want to make sure I have this. This is from Health Affairs.
Jeez.
1,115%. Contrast that with physicians, it's only increased by 200%.
That's insane. That shows you everything I was just talking about. It's people coding.
Yeah.
It's not. I'm not talking coding like programming computers. I'm saying making sure that you get your government payments.
Right.
Because it's coded correctly. There's an entire field of this. It's ridiculous. It's such wasteful hiring.
And Americans are spending a huge amount on healthcare in this country. And it's hard to compare those costs because in other countries where it's socialized, you're paying an astronomical amount in income taxes, sales taxes, right? Yeah. Everything is more expensive. But in this country, it is a broken system. It absolutely is a broken system. And by the way, it's a system that requires employers to provide insurance. And so you're also limited in the kind of insurance that you can provide for your employees. I think if we allowed employees, if we allowed people to pick their own health care, if we allowed insurance across state lines, if we allowed people to have a relationship with their doctor, with their care providers, if we put the power back in the hand of the consumer and the doctors and the care providers and limited the power of insurance companies as much as possible. We've talked about HSA accounts. We've talked about catastrophic insurance. There are obviously health exchanges out there, health sharing programs.
Yep, sharing.
These are all tools moving toward a solution. But you are right. You are right if you are angry to understand that those in D.C. have no interest in reforming this because of the lobbyists, because of the money coming in. And yes, it's a revolving door of favors from these lobbyists to government and then government back to these industries. But before you just blame a CEO and shoot a man who has a family,
right?
Look at the people who enable this systemic corruption. It's the same people who say we need to send hundreds of billions of dollars to Ukraine and we need to put boots on the ground in Syria. It's the same beast that we are feeding.
Yeah. And it's incredibly sad. That man did have a family.
Yeah.
Right? And I don't know that he was the supervillain either. Like from all accounts, I think somebody told me like he worked his way up in that company from kind of a very, very low position and made a lot of successful, decisions. Great. Maybe he made some bad decisions, but here's the thing. What do you think is going to replace him? It's just like in Syria. It's like, yeah, you toppled Assad. Great. Now what? That's no plan. That's just calling for chaos. Do you think the person behind him that's going to come in and be the CEO is going to be better? They're in the same system. If you want to really change this system, then fight to change the system. Don't be an idiot and go and shoot somebody for no reason.
Well, you want to know, hey, what can you do as far as changing the system? If you're in a small business, maybe all of you and the employees can get together and say, hey, we don't want you to provide health insurance. Just give us a credit so we can go and purchase our own health care. We've had that here, or we had it at one point, but you had some people going like, well, I want the business to provide health, which we do here. But I tell you what, it's more expensive. And people could get better health care if they decided to go out and purchase their own health care. But that's not how the system works. And you have many people who feel as though they're being wronged if you don't do that. So we provide health care, which is, of course, tied up with red tape, and options are limited because that's a system that we have. But people need to fundamentally change them. And we do. We provide health insurance here. It sucks compared to what you could go get individually if you just took a credit. Most people don't want to do it. Just like saving for your own retirement. Sure, you can rely on Social Security. You can rely on a 401k, but you could also go out and invest yourself in an index fund and have a far greater yield. People like the idea of personal freedom, but not personal accountability or responsibility. And we have a system that is predicated on that. I can tell you on the opposite side, the guy who signs the fronts of checks, not the backs of them, it's something you have to do, or people get mad. People could have better health care if they were willing to take a credit, go out and purchase their own. But a lot of people don't want to. And so that puts a lot of power in the hands of these companies, where in 70% of American counties, you have one or at most two options for health insurance. That's who your employer has to pick. Doesn't that suck? There's no way out of it until we change our mindset.
Yeah. We're a very unhealthy country, and it's not because we're idiots. We've farmed that out to somebody else. We've looked at the government's responsibility to make sure that we're taken care of health-wise. That's moronic.
And you know what else? We have a health system in this country that doesn't take into account actual preventative care.
No.
In other words, if I say, hey, I do blood work every I would say 3 times a year, right? You do it to try and make sure, check your cholesterol. High cholesterol can run in the family.
Yeah.
You do this, you go get a physical. Well, it's not covered because it's not medically necessary, but it's the kind of thing that would lower overall rates. We don't take that into account at all in our system. It's about treating the symptom. Oh, and by the way, all sizes are beautiful. You can be healthy at any weight.
That's not.
Thank you.
Always thinking of the other guy.
Gosh.
Yeah, there needs to be a change, but if people think the change is going to be a socialized system, take this and give it steroids.
Well, just look at COVID. Like, I think that has been the biggest eye-opener for the medical profession for most Americans that I can think of. I think people looked at it and go, wait a minute, these are the people that we were trusting. These are the people that said, like, these are the heroes. They didn't know what they were doing. They were doing stuff inappropriately. They were recommending things that really didn't even work, that they knew didn't work for 100 years. Like, Are you kidding me? These are the people we're supposed to trust? Hold on. Maybe the emperor has no clothes. Maybe that's true. Maybe doctors aren't gods. Maybe hospitals aren't always these benevolent institutions that are always looking out for me. They're looking out for themselves and trying to make a profit. Okay, got it. Now, maybe now that the blinders have been lifted, we can actually make some changes with RFK going in there and being a Tasmanian devil to some degree. Not that he's going to make all the great changes that we need to, but he is at least going to be crazy enough to try.
People have seen my doctor on the show, Dr. Troy. We need to have him back on with another What's Up Doc segment. He's not cheap. He's what they call like a concierge doctor. He's not even in the state, but it's thousands of dollars a year as a membership that you pay. I can get him on the phone. And he actually asks me questions and make sure that he'll call me up to check on me, make sure that I'm in good health. Hey, time to do some blood work. Hey, maybe it's time we want to put a heart rate monitor on you. Hey, we want to see how you're recovering from surgery. He actually cares about that because he has an incentive to keep his patients healthy because he has a direct relationship with them. It's a wonderful thing. A lot of people just aren't aware that actually exists out there. Because you go, well, I need the insurance because what if I have a procedure that's $150,000? Well, that's true. That is catastrophic insurance. And the reason those rates have inflated beyond control is because of the fact that insurance companies will pay it. There's no actual market rate that is being established in healthcare today. Hey, if you like this video, you can hit the notification bell there to know when new videos come out because I don't think subscriptions are still a thing on YouTube, but you know, you're an adult, most likely, so you can just choose one of the videos here to keep watching, and hopefully it's similar. I don't know what it is.